What's red and silly? A blood clot. You're welcome. Actually, blood clots are things that we take very seriously in hip surgery. They're a big problem in healthcare overall because they can cause a pulmonary embolism. This is when a clot breaks off from a vein, usually in the leg, and it travels up to the lungs. The clot blocks the circulation and this can kill you. The risk of having a pulmonary embolism is very small, about 2 in 1,000 people. The risk of a fatal pulmonary embolism is even smaller, but we need to try our best to make sure it doesn't happen. Blood flows back to the heart in our veins. We have superficial or surface veins that you can see, and deep veins that are buried deep within our muscles and organs. Veins have valves in them that force the blood to flow in one direction, back towards the heart. So why do clots form? Well, if we didn't have a clotting mechanism, we'd bleed to death if we cut ourselves. Blood contains platelets and proteins that are activated if there is damage to the lining of the blood vessel. They stick together and cause the red blood cells to clump. This forms a plug that stops the blood from flowing. Eventually, the plug smooths over and normal service resumes. It's miraculous, really. Things can go wrong, though. So why is this? Well, let's look at the things that affect the risk of having a blood clot. I've mentioned before that doctors like to categorise things into groups of 3. It helps us to remember what we're talking about. Rudolf Virchow was a 19th century German pathologist who described the factors that can cause a clot to form within a blood vessel. It's known as Virchow's triad. He was a very clever man who once challenged Bismarck to a duel with sausages as weapons. Let's look at the factors. The first thing to consider is if the blood isn't flowing properly. If it slows down or the flow is turbulent or rough, this can cause clotting factors to be activated spontaneously. Slow blood flow happens if you've been immobilised, such as during surgery, or after an injury, or even after a long-haul flight. The second factor is damage to the lining of the vein. This doesn't have to be caused by an injury. Microscopic changes can be caused by ageing, smoking, or even being overweight. The third factor is if the blood is more likely to clot than normal. Some people have genetic conditions that increase the risk. Dehydration, cancer, obesity, and the contraceptive pill are all known risk factors as well. Hip replacement surgery is regarded as a high-risk procedure for having a blood clot. Some studies have shown about 40 to 60% of people are at risk for a blood clot after hip surgery. Most of the time, you'd never known you'd had one. But because of the small risk of it breaking away and causing a pulmonary embolism, we have pathways of care and treatment that help to reduce this risk. What do we do? Well, first of all, everyone who is going to have hip surgery is assessed to see if they have a higher risk than normal. In these cases, we take extra precautions. The most important things we do are to make sure that you have quick, clean surgery, you have a spinal anaesthetic because that reduces the risk of having a DVT, so we recommend this. We keep you warm and well hydrated during the operation. You have pneumatic sleeves which are on your legs during the operation and they stay in place until you leave hospital. We get you up very quickly after surgery to get the blood flowing. A few hours after the operation, you'll be given an injection of heparin, which is an anticoagulant. The injections continue for 10 days and the nurses will teach you how to do this. After the 10 days, you just take an aspirin every day for a month. In the UK, there are national guidelines for the prevention of deep vein thrombosis and pulmonary embolism, and we of course follow these to the letter. How can you tell if you've had a DVT? Well, it's not easy, to be honest. Leg swelling after hip surgery is very common, but if the calf is red, tender and hot, then you should ask us for advice. We'll bring you back to hospital for an ultrasound scan, and this will confirm the diagnosis. If it is a DVT, then you'll need to have more drug treatment for several weeks. Most of the time, though, none of this happens, and most people have a smooth, uneventful recovery. If you'd like to know more, then please get in touch. The details are in the description below. Thanks for watching. See you next time.